Migraines are not just headaches. They are full neurological storms triggered by inflammation, hormones, gut imbalance, stress, sleep disruption, and nerve overactivity. Today I'm breaking down exactly what causes them, how we diagnose them, and which treatments actually work, from conventional medicine to alternative medicine, Ayurveda, herbs, and natural therapies. I'm Suburban Prepper, a Desert Storm combat medic, an Afghanistan combat medic, a former 160th Special Operations Aviation Regiment flight medic, a family nurse practitioner, and a graduate of the George Washington University Fellowship in Integrative and Alternative Medicine. I treat migraines in real clinical practice, and I've helped countless patients reduce or eliminate chronic migraines using medical science, functional medicine, Ayurvedic principles, and targeted supplements. Today, you're getting the complete picture. This video is for educational purposes only. Always work with a licensed provider when starting any treatment. By the end of this video, you'll learn what a migraine really is, the signs and symptoms, the imaging and lab work, every conventional treatment option, including Botox and Vyepti, Ayurvedic approaches, herbal therapies like wild lettuce and magnesium glycinate, and non-pharmacological tools like the Cephaly device, acupuncture, reflexology, auricular therapy, and aromatherapy. A migraine is a neurovascular inflammatory event. The trigeminal nerve becomes overactive, inflammatory neuropeptides are released, blood vessels swell, and pain pathways activate. This creates brain hypersensitivity to light, sound, smell, and movement. This is a brainstem level inflammatory storm. Before the pain ever starts, the body sends warnings: fatigue, yawning, irritability, neck stiffness, and food cravings during the prodrome phase. Aura can bring flashing lights, zigzags, blind spots, tingling in the face or hands, or trouble speaking. The attack phase brings throbbing, head pain, nausea, vomiting, dizziness, and extreme sensitivity to light and sound. Afterward comes exhaustion, cognitive slowdown, and mood shifts. Most migraines do not require imaging, but a CT scan is used for sudden severe headaches to rule out bleeding, and an MRI is used when migraines change, worsen, or include neurological symptoms. Lab work is crucial. A full thyroid panel, thyroid stimulating hormone, free T3, free T4, and reverse T3 identifies metabolic problems. Low thyroid increases fatigue and triggers migraines. High thyroid overstimulates the nervous system. Female hormone labs, estrogen, progesterone, follicle stimulating hormone, luteinizing hormone, identify menstrual and perimenopausal migraine patterns. Male hormone testing checks testosterone because low testosterone increases pain sensitivity. Cortisol evaluates stress-driven migraines. Dehydroepiandrosterone sulfate reflects adrenal function. Vitamin D shows inflammatory status. Magnesium levels look for nerve hyperexcitability. Inflammatory markers such as C-reactive protein reveal systemic inflammation. A complete blood count and comprehensive metabolic panel evaluate hydration, electrolytes, anemia, kidney function, and liver function. Now for conventional treatments. Over-the-counter anti-inflammatories work early in the attack but fail once the cascade progresses. Triptans constrict dilated blood vessels and block trigeminal nerve signaling, but fail when taken too late. Calcitonin gene-related peptide blockers such as Aimovig, Ajovy, and Emgality prevent migraines by blocking the inflammatory protein at the root. Calcitonin gene-related peptide antagonists such as Nurtec and Ubrelvy stop acute migraines without blood vessel constriction. Anti-nausea medications control vomiting so other medicines can work. Beta blockers reduce vascular sensitivity. Certain antidepressants calm nerve excitability. Anti-seizure medications stabilize electrical pathways. Steroids break prolonged migraine cycles. Botox blocks neurotransmitter release from overactive nerve endings and prevents chronic migraines. It works best in patients with long-standing nerve hyperactivity. It fails when the dose is too low or when lifestyle triggers remain uncontrolled. Vyepti is an intravenous migraine prevention medication that blocks calcitonin gene-related peptide directly in the bloodstream and stops the migraine cascade before it begins. It is highly effective for chronic, severe migraines. The Cephally device delivers gentle electrical stimulation to the trigeminal nerve and helps both prevent attacks and abort early-stage migraines. Migraine triggers include alcohol, energy drinks, artificial sweeteners, chocolate, aged cheese, processed meats, monosodium glutamate, sugar spikes, dehydration, poor sleep, stress, skipped meals, hormonal changes, and gut imbalance. Gut inflammation affects serotonin production, which regulates pain. Ayurveda explains migraines as a pitta imbalance, excess heat, inflammation, and intensity, often combined with vata imbalance, which causes instability, overstimulation, and stress sensitivity. Digestion plays a central role through the concept of Agni, or digestive fire. Weak or disturbed Agni increases inflammation and migraine frequency. Ayurvedic cooling therapies include coconut water, aloe vera juice, cucumber, mint tea, and coriander seed tea. Avoiding heating foods such as vinegar, caffeine, spicy foods, and alcohol helps reduce flare-ups. Nausea therapy applies warm sesame oil inside the nostrils to soothe trigeminal pathways. Shirodhara pours warm oil across the forehead to calm the nervous system. Scalp and neck oil massage relieves muscle and nerve tension. Herbal and nutritional treatments can be extremely effective. Ginger reduces inflammation and nausea. Turmeric lowers neuroinflammation. Feverfew reduces blood vessel overreactivity. Butterbur, when labeled pyrrolizidine alkaloid-free, blocks inflammatory pathways. Peppermint oil relaxes scalp muscles. Wild lettuce has traditionally been used to calm the nervous system and reduce headache intensity. Magnesium glycinate is the best absorbed form of magnesium and calms overexcited neurons. Riboflavin, also known as vitamin B2, stabilizes brain energy pathways. Coenzyme Q10 enhances cellular energy production. Melatonin restores sleep cycles. Acupuncture reduces nerve tension. Foot reflexology stimulates head-related pressure points. Auricular therapy activates ear points connected to the vagus nerve. Aromatherapy using lavender, peppermint, or rosemary reduces stress-driven migraines. Migraines begin in the brainstem. Serotonin is produced mostly in the gut. Hormones drive menstrual migraines. Magnesium deficiency is one of the most common triggers. Botox calms nerve endings. Vyepti blocks inflammatory proteins. Ayurveda cools the system by restoring pitta balance. Diet, sleep, hydration, and stress management are major drivers of migraine stability. Migraines aren't random. They appear when your trigger load gets too heavy. Dehydration, poor sleep, processed food, hormonal shifts, gut imbalance, stress, and irregular schedules all stacking together. If you're serious about healing naturally, hit subscribe. I drop alternative medicine videos every week, backed by real clinical experience. And before you go, check out my Suburban Prepper Amazon storefront, specifically the holistic medicine section, where I list many of the herbs, supplements, migraine tools, and natural therapies I talk about in these videos. It's all organized, so you can find what you need quickly. Comment below and tell me your number one migraine trigger: dehydration, hormones, chocolate, stress, or lack of sleep. Your comments choose the next video topic.
This is healing.
This is resilience.
This is alternative medicine.